Hi, this is Galina, and welcome to Animal Wellness Podcast. Today, we will be speaking with Elaine, the Director of Animal Wellness in East Brisbane. The podcast topic today is animal vaccinations. So thank you again, Elaine, for joining us. And what do you think about vaccinations?
Okay, thanks for raising this very important topic. It is a manifold area. There's lots of things to consider about vaccinations, and they are very important biological preparations. I have lived through the time when parvovirus just started to rear its ugly head. That's a particularly nasty viral disease that causes hemorrhagic gastroenteritis, particularly in puppies. And we did used to lose a few of those, and it's very smelly. If you've ever smelt bloody dysenteric diarrhea, it kind of, it sticks to your nasal hairs, and it really wrecks the feeling of the room. So it is something that we really don't want dogs to have to endure or go through. Nowadays, we're a lot better at actually saving those little lives, which is good. But vaccines do have their purpose from that aspect. But we do also see problems with over-vaccinating. So we do have to have a chat about immunology and how these things work.
So I guess what exactly are vaccines and what is their purpose?
Mm-hmm. So vaccines are biological preparations that are manufactured to stimulate immunity to a disease. They are made up of an infectious agent, which could be a bacteria or a virus that's been attenuated or made to be benign so that they are actually not going to give the animal that disease. So that's the purpose of actually killing those bacteria or making the virus to be just part of the virus particle and not the whole virus, so that they don't actually make the animal, or the human for that matter, sick for when it is injected into that living being. Vaccines also contain things that are called adjuvants. Those are additives to boost that immune response. And some of these adjuvants are things like aluminum hydroxide. And in the olden days, about 10 years ago, they used to use thimerosal as a preservative, which is mercury, a type of mercury, that shouldn't be in many vaccines anymore, although in humans, there is a bit of thimerosal in some of the multivalent flu vaccines. So, for people and pets, if you can have a look at the product insert and find out what's actually in it before you use it, that's a good idea. So preservatives like thimerosal, and there's other sorts of preservatives, little bits of formalin and other sorts of things to stop the vaccine becoming a bacterial soup of contamination. You don't want to go jabbing and injecting things that might make the patient very ill. So the most common vaccines that we use in Australia, in Queensland, is a C3, which contains 3 virus particles. It's distemper, hepatitis, and parvovirus. Having said that, we haven't seen distemper or hepatitis in the Brisbane area for many, many years. There is pockets of parvovirus every now and again in certain suburbs. So from that aspect, it's probably worthwhile having at least 1 or 2 vaccines for those little puppies. And that's the 3 part of the vaccine. And then there's 2 other parts to make the 3 plus 2 into a C5 component, or a 5-in-1 component. And those other 2 components make up kennel cough, Bordetella bronchoseptica, which is bacteria, and then a para-influenza virus. Now, it's important to know that vaccines are in a variety of forms. So some vaccines have a 5-in-1 as an injection. We don't use that one. I have seen a few reactions to the kennel cough component being injected, and it's probably not as effective as the kennel cough component being drops either in the nose or in the mouth. And that makes sense because you want the immunity in the nasal passages to be present. So you may as well prime that area to work that way. So that's a local delivery. And that's in a nutshell what dogs need as their vaccine. Now, cats, we use an F3 as the standard, and that's a feline enteritis and a couple of cat flu components. Cat flu is quite devastating if the cats are coming from, say, a rescue group where one cat with cat flu can infect all the other cats. So, it's not a good disease for cats to have. And sometimes if they pick that up, like the herpes virus one that cats can get, they can have that like for life. So if they ever get stressed, they start to shed it, sort of thing. So it is a good idea to not let cats get that particular type of bug. There's a couple of other sorts of vaccines that you might consider depending on where you live. There was an outbreak of leptospirosis in areas of Sydney and also further north, so there is a vaccine for that. We don't really see that in Brisbane, so it's not routinely given. There's rabies vaccines in America, but we don't actually have rabies recognised in Australia, so we don't vaccinate against rabies in Australia, although there is rabies in Bali, and so we do have to be vigilant and make sure that we don't really see that come into our country. That's why, we're lucky we're a little island that way. Then I think cats, you can also get an FIV, which is an AIDS type of virus that cats can get, and there is a vaccine that is fairly effective against that as well, but that is a killed vaccine. And with the killed vaccines, you need to give at least 3 vaccines of that. So one every 2 to 4 weeks for about 3 deliveries. So a little bit more than some of the modified live vaccines. Yeah.
That sounds that vaccines are really important. But how would you say that they are effective? Would you say that, generally?
Yeah, generally they're fairly effective. You do have to. So when babies are born, they get mother's immunity. So they get the antibodies through the belly button. Mammals, get all their nutrition through their belly button when they're in their mummies. And then when they're born, they have colostrum, which is that first milk that mothers make. And the colostrum, mammals' bodies are amazing. Mothers are amazing, aren't they? So the milk that comes through in the initial few weeks has a lot of antibodies. So that will give natural immunity to the puppy or the kitten or the human. But it does depend on if the mother has been exposed to those diseases or has been vaccinated against those diseases. If she hasn't, then her milk will not have antibodies that will protect the babies. Now, in the canine world, for instance, pretty much most of the dogs will have antibodies because they've had vaccines and they've been exposed to these viruses. And therefore, the puppies, after they've come out of the mummy, will have some antibodies from being in the mummy's tummy, and then also will be picking up antibodies from nursing on the mother's teats. And so those antibodies will protect the puppies until such time as those antibodies wane and go out of the puppy. So they're a protein that lasts in the puppy for anywhere from 0 weeks at birth to somewhere around 10 weeks of the puppy's age, and then they wane. They won't be enough to protect the puppy for life because they're not made by the puppy, they're just given to the puppy. So once those antibodies have waned, the puppy needs to make its own antibodies. So there's a few ways that could work if the puppy hasn't been vaccinated, and that would be if the puppy, for instance, was exposed at a young age to the virus in the background, but only a tiny amount, like not walking in parvovirus poo, for instance, but only a tiny amount, and then the mother's antibodies slowly waning and the puppy's building up its own immunity. So I do know that has happened with some people that aim to get natural immunity, but it can also be disastrous because if the puppy's mother's antibodies are gone out of the puppies, and then they get exposed to parvo, they can get very sick and they can die. So that's why it's a bit complicated with vaccine schedules, because you want to give the puppy a vaccine before the mother's antibodies are totally gone to protect it in case it gets exposed. So that's the first vaccine that's given at 6 to 8 weeks of puppyhood. And then knowing that the mother's antibodies will be out of the dog by around 10 to 12-ish weeks, you want to give another shot after that. So if the second puppy shot is given at around 11, 12, 13 weeks, somewhere in there, then that should take, and that puppy, being a healthy puppy on a good diet, should have possibly lifelong immunity, but at least for several years. And the way you can judge that is you can actually have the vet do an antibody test, which means taking some blood several weeks or months after that second shot to make sure that the dog does in fact have antibodies. And then you know.
So would that relate to teenage dogs after 12 months, same as cats, and how does it differ from adult?
Yeah, that's right. So generally in Queensland, in Australia, most dogs and cats are desexed. The cats, the queens, are desexed because they're just good breeders and you end up with a cat plague, too many cats, right? So usually the cats are desexed. The boys, because they'll spray and mark their territory, and cat urine really stinks. So to make better pets, these cats are desexed at around about 5 months of age, that sort of thing. Now, at that time, they should have already had a vaccine. Now, it's a bit tricky with cats because the cat flu component of the vaccine doesn't really, and the same with the dog, for instance, the kennel cough, those two components don't last longer than a year or so, which is the same sort of thing with the flu vaccine for humans. And there's a lot of controversy about that as well. But for sure, if you have a cat and you're going to put it in a boarding kennel where it will and could possibly pick up cat flu, you would want to boost your cat for cat flu by vaccine at least 2 or 3 weeks before you put it in a boarding kennel situation where it might pick up cat flu. So you probably wouldn't bother doing an antibody test on a cat, but you would probably make sure that it is vaccinated against the feline enteritis and the cat flu anyway. Now the dog, when it's coming in for its desex, large breed dogs, we recommend desexing them later in life. There's some studies that show that it helps to have the bones grow to the length that they need to, and by removing the gonads, it can affect the length of the bone and possibly increase cruciate damage if you desex them too early. And there is an incidence of increased urinary incontinence in the bitch, in the female dog, if you desex them too early. So certainly when they come in at about 12 months of age, that would be a good time for the dog to have an antibody titer test to find out that its distemper, hepatitis and parvo levels are really high. And if you get that result, and usually you do, you shouldn't have to worry about revaccinating them again, at least for 2 to 3 or 4 years, really. So if you've got, so we use a BioGal test kit, and it comes in a number form. So a 6 is the highest level that you can get on that one. And then a 5, and then a 4, and then a 3. Anything 2 or under is something that you would consider vaccinating against. Now, we very, very rarely see anything lower than a 3 for distemper, hepatitis, and parvo, and certainly not for parvo. Usually the parvo level is about a 5 or a 6 on those titer test kits. So then you're pretty much good to go. So it's probably worthwhile, if you're having a desex operation on your dog, to consider having an antibody titer test at the same time.
So
you know.
Are actually really important for your animals. Would you say that there might be some side effects? And if so, what are the side effects that you often see at your clinic?
Yeah, so that is a really important and a very good question. And I think it's important for everybody to understand that although vaccines are largely safe and effective, it is very possible to have side effects from vaccines. So the stronger modified live virus vaccines, you can get fevers. then there is also the possibility of the adjuvants, the contaminants and the preservatives causing some problems. And then mixing too many agents in one vaccine, or also perhaps giving something like a pro-heart injection, which is not a vaccine, but a heartworm preventative insecticide at the same time. All of these things could create too much of a load onto that animal's body. So because animal wellness is a holistic clinic, we do see many people and pets that have vaccine damage. Some of the things that we see, particularly in the smaller white fluffy dogs, the vaccine reactions that we've seen have been immunological problems, such as ITP, or so we have a low level of platelets, where the platelets have been attacked by the body like an autoimmune disease. We've also seen a rheumatoid arthritis sort of reaction, and we also see atopic disease or skin dermatitis. Usually these things happen within 3 months of a vaccine. So if you get hyperimmunized, your body gets confused about, what's self and what's not self, and sometimes it starts reacting badly to itself. Some of the worst reactions we've seen have been seizures following a vaccine within 12 hours. I do try to get the owner and the previous vet to look at the numbers that are on the vaccine manufacturing and to report these as adverse events, which can be done online now through the AVPMA. But I must say that most of these adverse events are generally not recognized as being part of the vaccine. And unfortunately, we have a low incidence of reporting these adverse events. So I'm hoping that if this is clicking some bells in some people's minds at listening to this podcast, that they will go online and report this as a possible adverse event. And to be fair, if it's 3 months after a vaccine, it's hard to put, one and one together and come up with that. But as a naturopath, I've gone to many lectures by integrative doctors around the world, and it's really opened my eyes, so that I've had lunch and chatted to Dr. or Professor Schoenfeld from Israel, and he's done a lot of work linking the hyperreaction called ASIA syndrome, ASIA, which is adverse reactions to adjuvants injected, mostly aluminum hydroxide. And then Professor Lujan from the university in Spain also found this similar reactions to vaccines when a blue tongue virus vaccine in sheep was developed. And then all of these sheep were having neurological problems like, severe seizures, epilepsy, autistic type behaviors, actually. So you will hear over and over again that, Dr. Wakefield, who said that the autistic children that he was examining as a pediatric gastroenterologist do have problems with the MMR vaccine, and this created an uproar throughout the world. And vaccines unfortunately can cause some encephalopathy, and encephalopathy is basically some brain damage, and then that in fact is seen as autistic or ADHD sort of behavior in some children. So there is some theory that some of the animals may be showing some of these signs. So it's important that we only vaccinate with what we need to vaccinate against with effective vaccines, and that we also help the puppy and the kitten to have a very healthy nutritional base and a good sort of lifestyle, so that they are quite healthy at the time that they have a vaccine. Also on the vaccine product insert, there's a little blurb that says, do not vaccinate sick or pregnant animals, for instance. And a lot of the time, puppies and kittens are teething. So if they've got a fever and they've got like this open blood-brain barrier, that's not a good time to actually put a vaccine in them. And I have at times had them come in and haven't been quite happy with their rectal temperature and said, you know what, I'm just going to give you a little bit of vitamin E and perhaps some spirulina. Let's up their nutrition for a few days, and then perhaps we can look at doing that, 12 to 13, 14-week vaccine a little bit later, maybe in a few days. And I think that's a better way to look at it. You really shouldn't be vaccinating a sick individual. It's contraindicated.
So speaking of vaccines, Elaine, right now we are in the middle of a vaccine debate with the coronavirus for humans.
Mm-hmm.
So
Right.
to that discussion right now, what do you think about the coronavirus relating to your pets? Can pets get it? Can pets not get it? I know there's coronavirus for in cats. So
Mm-hmm.
did you want to speak a little bit about that?
Yeah, well, that's right. Cats can get an FIP, feline infectious peritonitis, is caused by a coronavirus. They have not been able to develop a good vaccine that prevents that, which is why it's a little bit concerning that they are pushing the agenda of manufacturing a COVID vaccine to get everybody out of this pandemic. I mean, I understand why you would want that, so people are not in lockdown and they can move about more freely if you can make a vaccine that's safe and effective. My concern, talking about humans now, and probably also dogs, we just don't have enough genetic background to know enough about all the different SNPs and types of individual genetics that predispose people and dogs to have vaccine reactions. But certainly in perhaps some of those kids who have had vaccine damage, we now know that there is a genetic basis that kind of underlies those adverse reactions in some of them. We know, for instance, an MTHFR gene and also a COMT gene, and there's a few other ones in humans. So if you have this genetic basis, you should really be thinking about a reduced vaccine schedule, or perhaps not at all, perhaps. And in a lot of those little white fluffy dogs that do have vaccine reactions, it's possible that they have some sort of genetic predisposition to be affected by that. So two things about the COVID. One, the coronavirus vaccines for animals haven't been all that effective. Otherwise, we would not have FIP around at all. And coronavirus is really weird because, as the same with COVID, 98% or more of the humans that have been exposed to coronavirus don't even know that they have had an exposure to it, don't seem to get sick, etc., etc. And yet some, those that are immunocompromised, and say people over the age of 70, and then certainly those that are over the age of 80, some of these elderly people have very poor immune systems, and they're not absorbing their trace mineral and nutrients that they need, like the zinc, and they're on a poor diet, don't drink enough, need extra care, for instance. And so they can succumb and get quite ill to the coronavirus, and also have some nasty side effects. So, for instance, if some people succumb to having flu, and they can develop autoimmune problems from that. So Guillain-Barré disease, which is basically a paralysis, can happen from both a vaccine and also from a viral infection. And also you can have some of the excipients in or adjuvants of vaccines, like the aluminum hydroxides, that can get in your fascia and your muscle and can cause chronic fatigue syndromes and myofasciitis and myositis and joint pain and muscle pain and headaches and things like that. So, I'm all in favor of making safe vaccines. I often wonder, why don't we use preservatives like vitamin E in the vaccines instead of some of the other things that they've chosen? So, I'm not a vaccine manufacturer. I guess maybe if you put some of those things in, maybe they grow more bacteria and then you inject them in humans. Like there's a whole case of kids in Bundaberg when they were initially doing, I think it was polio vaccines, it might have been smallpox, but there were hundreds of kids that were given a vaccine. They all got septicemia. Many of them died because the vaccine didn't have adequate preservatives in there and there was bacteria contamination. So yeah, manufacturing, food science, and it's tricky. So I understand that, and vaccines can be effective, but right now, coronavirus, we they're rushing it. I can understand why they're rushing it, but I know already there was one patient in the trial who had been given that preliminary vaccine who developed transverse myelitis, which is kind of like a polio and like a Guillain-Barré, and that's a bad thing. We really won't know the long-term effect on that particular patient. Could end up with chronic fatigue syndrome, like forever. So given that the majority of the people get exposed to corona and are actually doing fine, it's a big question mark. Do we want to randomly just put out a vaccine that's going to perhaps cause some bad side effects in a lot of people? And what percentage would that be? And as I said before, not enough reporting is done about adverse events because they're not being recognized. So if you get sick with, say, chronic fatigue and myofasciitis within 3 months, or certainly even later, it's going to be difficult to actually pinpoint that down as causative by the vaccine. Yet if you go into the medical literature, you can see some of these biopsies from muscles of these people that have been chronically unwell have found the aluminum hydroxide sitting there. They can stain it up on histology and go, oh, well, that's it. And then you think, well, how did the patient get that in their body? Well, we know it's actually the adjuvant that's gotten there. And then also within the veterinary profession, there are many cases of cats that have had a nasty cancer called fibrosarcoma that comes up at the site of where usually the killed vaccine, there's more adjuvant in a killed vaccine than there is in a modified life. So a lot of people are saying, well, if you get all these immune reactions to a modified life, let's all just use killed vaccine. Well, no, you're going to actually have more adjuvant in a killed vaccine. So there's a lot to vaccine science, isn't there? And a lot to be concerned about. So, I'd say bottom line is figure out what you really need. Like, for instance, kids, do you need 42 vaccines by the time they're 2 years old? Or do you? When I was a kid, I think I had 2 vaccines, maybe 3. So things have now changed because of the mantra that vaccines are safe and effective, and they're not always 100% safe. So we need to really think about it, which is why our practice prefers to just do 2 vaccines and then antibody titer test to make sure that we're causing minimal harm and maximum benefit. Yeah.
So it's a very controversial topic, and what I'm getting from this is basically what you're saying is to train yourself to see your vet for an animal wellness exam, not always a vaccine. So a titer test would be a good thing to do once a year, and that would be part of the wellness exam as well. So always have a chat to your vet and don't be upset to get a second opinion when you feel it correct. Is that right, Elaine?
Yeah, that is. Yep. Stand up for, what the science is saying, and knowing that the modified life vaccines usually do give really good immunity for quite a long time. Question whether you should have an annual vaccine. And I'd say most vets are now aware of that. And in fact, the World Small Animal Vet Association has put out documents that try to explain that to the majority of vets. And I think a lot of vets are still thinking, oh yeah, vaccines are safe and effective, and if they're so safe, we can just give them a vaccine every single year and it will be fine. But we do get concerned about that because, as I said, our practice is a holistic practice and we see the damaged ones and we recognize that too. So that is quite an important thing. So yeah, so thank you for raising those points. Yeah.
Expertise, Elaine. So vaccines are an important tool in keeping your dog healthy. However, they do need to be carefully used to make sure they cause no harm. So if you are thinking about vaccinating your dog, please discuss vaccination with your vet about your pet, and a second opinion never hurts. So Elaine, thank you so much. Is there any last word you'd like to tell our listeners?
Yeah, I think there's a lot more that people are learning about wellness and how to look after yourselves and your pets. And, vets do a fantastic job. They really do. And so if you can, if you can ask your vet if they do undertake antibody titer testing. Most vets can send it away, and that one can be a little bit expensive. But there are lots of vets that are using in-house titer test kits. And if you are seeing a vet that doesn't have an in-house titer test kit, they're more than welcome to contact me at Animal Wellness, and I can explain how they can access or purchase an in-house kit and explain to them how they can use it so that they too can actually provide that service. I would like to see the science of, vets understanding immunology and looking at doing that. It is a little bit more time consuming. The test kit does take a bit of time, and you also have to take a little bit of blood too. So sometimes it's a lot easier to just go ahead and get a vaccine. And also, if you have a very robust dog on a very good diet, the chances of it having a vaccine reaction of a really bad degree is probably low. But certainly, if we relate atopic skin disease and dermatoses and some of these other autoimmune things like Hashimoto's thyroiditis, it's probably larger than 3%, which is the documented rate of adverse events. So I'm saying there probably are more adverse events than is recognized, and we do our best to try and minimize it. So, okay, thank you.
Thank you for your expertise, Elaine, and we will do another podcast next week. Thank you, listeners, and have a great day.